Principles of Graphic Medicine, RX. So, what is graphic medicine? To put it simply, graphic medicine is the intersection of the medium of comics with the discourse of healthcare, and it's a way of offering a more inclusive perspective of medicine and illness. It does this by using comics as a playful medium for those living with mental or physical illness to represent their illness through a lived experience. In medicine, images often act as diagnostic and educational tools for practitioners such as doctors and nurses to identify illnesses, both mental and physical. But the problem with this is that there's no one truth to any illness, and many of these images construct illness stereotypes that then practitioners carry forward into their practice. Graphic medicine strives to change this by giving power of representation to those experiencing illness. An example of this shift of power is used first by this Charcot image that we were shown on the first day of class. It's an image of a woman who does not have hysteria, or what would have been called hysteria back in that time, taken by somebody who doesn't have hysteria, and then represented by somebody who also doesn't have hysteria. And the second image is a picture from RX, in which Lindsay is portraying the way she feels during a manic episode and how she sees herself. And this could be a much more realistic representation than the first image.
Graphic medicine can be used as a diagnostic tool for people who experience symptoms of mental illness. Everyone experiences their illness differently. This can make it difficult to verbally describe symptoms clearly, but by portraying symptoms visually in comics, it can make it easier for people with some mental illnesses to recognize these symptoms within themselves. Symptoms such as anxiety are difficult to explain out of context, but by showing a specific example of anxiety, like being nervous and jittery on public transportation, can help people to better identify their symptoms. Being able to recognize and react to symptoms is a big part of managing mental illness, and having the right tools to do so is very important.
Another goal of graphic medicine is to destigmatize whatever illness the comic is portraying. This is done by showing how the illness functions in the real world, or by allowing for there to be multiple, even conflicting ideas of how the illness is defined. Works that fit this principle will strive to challenge the idea of the universal patient and will also challenge the textbook definition of the illness. The author has complete freedom over their work, allowing them to use the visual to affect the mind of the reader. By using scattered and busy art while writing about her manic episodes, Lindsay is able to describe how mania feels to her on two separate levels. This allows the reader not only to understand the mental illness, but to feel the mania themselves trying to read the scattered words in the busy pages. This takes away the necessity for a textbook definition of any illness and also destigmatizes the illness. It shows Lindsay functioning in her daily life, but also shows her internal struggle, which can be hard for people to understand. By engaging the visual in the piece, Lindsay puts a face and a normality to her mental illness. Oftentimes when we think about mental illness, we're thinking about the illness itself as an abstract. Lindsay's personal account not only puts a face to bipolar, but it puts an entire life and personality into it. With this as an added resource, anyone who wants to learn about bipolar has an understanding of the illness as it affects a person in their life, not as a textbook definition. By personalizing these accounts of mental illness, we are not looking at the illness, but the effect it has on a person and their life.
Principle number 3 is initiating change in the healthcare system. Lindsay does this first by describing her time working for Big Pharma, marketing antidepressants for which she herself is the target audience. She uses her images to highlight the flaws in the pharmaceutical advertising system, especially as advertisements shape visual culture, and highlighting the flaws in the way that advertisers represent mental illness and how that shapes society's view of mental health as a whole. This is a spread from where she was describing the typical antidepressant commercial. It portrays the drug as a magical fix to depression for an able-bodied heterosexual white woman with a nuclear family. It's an iconographic representation that enforces gender roles and norms for sexuality and disability. She also describes the vicious cycle she is stuck in. She needs to work at a job she dislikes to have health insurance in order to pay for the pills that she needs. This is a reality for many Americans, and working at a job she hated was not beneficial to her mental health. She felt like she was trapping other patients in the lifestyle that she lived, which was making her feel very, very bad. And finally, she shows flaws with inpatient psychiatric medicine through a juxtaposition between how she was seeing herself during that time versus how the practitioners in the hospital were seeing her. She was being encouraged to go back to a lifestyle that she hated and that contributed to her manic episode in the first place. And also it shows that there was one set of rules that all of the patients were expected to follow to be seen as sane, but the mental health population all needs different things, and there is no one set of rules in reality.